And the issue is when these things kind of stack up, you have several of these at once, that's when the nausea becomes pretty severe, or you just feel like I can't get anything done. It's also why kind of a one-size-fits-all approach doesn't necessarily work. It's why one mom can go to her provider and another mom can go to her provider, and they're both given the same information and the same cure, or, use this and you'll get better, and one will work and the other won't. Getting pregnant and giving birth are two of the most exciting things you can ever hope to experience in this life. The moment you think you could be pregnant, you're frantically searching for all the best information, which is why you're here today. I'm Stephanie King, and with my many years of experience as a professional childbirth educator, doula, and lover of all things pregnancy, birth, and postpartum, I'm here to make preparing for your birth enjoyable, empowering, and totally easy. Each week, I'll cover different topics, interview professionals, and get into the nitty-gritty birth stories from mamas just like you. And when you're ready for more, you can join me in the My Essential Birth course at myessentialbirth.com, where I take you step by step through exactly how to prepare your mind, body, spirit, and partner for a birth you love. So let's get started. So today I'm going to talk to you guys about pregnancy nausea, but I'm going to take it for a little spin because I think a lot of times you hear the very common, make sure you've got some little saltine crackers next to you on the bed so you put them in your mouth before you even get up, or wear the seasick bands, or use some peppermint oil. And yes, I am going to make sure and mention all of those things today, but I want to go a little bit deeper. I want to kind of hit up that holistic part of nausea and talk to you about the why this might be happening and how to figure out what it is so that you can actually not just mess with the symptoms, but kind of hit the source. So if you are early in pregnancy and having nausea, like that 6, 7, 8-week period, or even before 12 weeks, or you are still having nausea later in pregnancy, let's kind of dive in and talk about some of those whys behind it. Now, first of all, I want you guys all to understand your body is not broken. There's nothing wrong with you. It's just that you're getting some signals saying, hey, this or that is off. And I would like you to pay attention, or like, we can't handle this anymore. Things are a little bit out of whack. And that's why this is kind of going on. Now, for many moms, this can get brushed off, especially with providers or even well-meaning friends and family, where it's like, it's just morning sickness or whatever you want to call it, even though many of you are not experiencing it just in the morning and it's like an all day or whatever event. And for some women, it is extremely debilitating. Like, you're just trying to function and get through the day, and it can be really overwhelming. And you're being told like, oh, it's a sign your baby's healthy. It's whatever you might be being told. And nobody's kind of hitting and nailing down the why behind it. So I want to talk about why it's so intense so early, kind of what we're going to be assessing, or what you should be assessing for before jumping into medication, and how we can support our body first in a really meaningful way. Because if the first thing we're doing is hitting at medication, there's a time and place for medication, sure. But if the first thing we're doing is trying to mask that symptom, then we might not have an idea of what's really going on underneath. So I think medication is great, but I think that there's some other tools that we can use before we use that one as a tool. Now, let's talk about the why it can be so intense. Now, early on, there is a lot of demand happening from the body, right? We are building a baby from scratch, and it takes a lot of energy. It takes a lot of hormones. You have to grow an entire other organ called the placenta that is going to grow and nourish and strengthen your baby. And especially in those early days, before that placenta is functioning and working and doing all of its good stuff that it does, the nutrition, the everything that your baby needs is coming from mom's body. And so there's a lot of that happening on top of the fact that you've got this hormone, that HCG and progesterone, right? They're rising really rapidly. That's why, you go in and you have a blood test and you hear like your numbers are doubling, are doubling. There's a lot that is happening. You're producing a lot more blood. There's like all of this stuff is happening inside of us. And there are side effects that come from that in the way of the different pregnancy symptoms that we have. On top of that, you have blood sugar regulation that is happening, and moms are more sensitive to insulin And then you have the digestion that slows, right? We've got relaxin, we've got progesterone, we've got these things that help the body to do what it needs to be able to do. And it also slows down some of our processes. And that's why we have moms that like early on have issues with constipation and stuff like that, or digestive issues. That's really common. And this is kind of the why behind it. And the truth is, these things kind of happen overnight. It's like the second you take that pregnancy test, if you're anything like me, the second you take the pregnancy test, you are so tired you're going to hit the floor and you're so nauseous you can't sit up straight. And so that it's like instant. It is very like the demand is immediate. And that is why you feel a lot of that, especially early on. Okay. So let's kind of talk about from that holistic perspective, what are some of those things that might be causing the nausea in the first place? Now, you heard me talk about blood sugar. Like I said, you're more insulin sensitive. And so your blood sugar is going to be a little bit trickier to control because of that. And so a lot of the times, and this is where it gets tricky, we are being told to do these little things that might make you feel better for a little, and then you feel way worse. And I'm going to tell you why in just a little bit. Another reason is low protein intake. Now, you guys know I'm on you all the time about protein and that it's good for keeping you away from gestational diabetes, keeping you clear from preeclampsia and these other pregnancy issues, from gaining too much weight, from feeling fatigued and whatever. The deal is, though, that protein, because it's that building block of life, it's also going to help with your nausea and other symptoms that you're having, including headaches and excessive weight gain, bloating, swelling. It helps with a lot of these issues and adequate salt intake and some of these other things as well. But high protein diets are where it's at for pregnancy. So the very, very minimum that you should be getting, we say 80 grams. 80 grams is the minimum to like, we're just like barely touching where we need to be, right? I'm going to tell you a minimum of 120. So aim for 120 to like 200 grams plus per day. And your need for protein becomes more as you are more pregnant, which would make sense since your baby is bigger, that placenta is bigger. We're building an entire child. That protein intake is going to be more and more important and go up over time each trimester. But in other words, aim for that high protein, okay? Dehydration and electrolyte loss is a really common problem early in pregnancy. And this can be kind of that catch-22 because you are not feeling like you want to eat. Maybe you're vomiting. And so you're already feeling like, I don't want to put stuff into my body. So it's easy to get dehydrated. And then when we have the like upset stomach and we do find ourselves vomiting or whatever, then it makes it even worse and it kind of compounds that issue. And then, drinking water can make you feel sick and compound the issue. So I'm going to talk to you about how to get all of that in just a sec. The next one is mineral depletion. And especially when we're talking about minerals, we were talking about B6 and magnesium. So I'm going to talk about that as well. And then you've got this kind of nervous system overload, just everything that is happening to create this baby, and your thyroid shifts as well. So you've got your T3, your T4, the thyroid stimulating hormone that we're talking about. And depending on if it makes you more hyper or hypo, then you can definitely feel more sick or not. So we'll go over that in a sec too. And the issue is when these things kind of stack up, you have several of these at once, that's when the nausea becomes pretty severe or you just feel like I can't get anything done. It's also why kind of a one-size-fits-all approach doesn't necessarily work. It's why one mom can go to her provider and another mom can go to her provider and they're both given the same information and the same cure or, use this and you'll get better, and one will work and the other won't. So keep that in mind as we go through this. Hopefully it just gives you more information and more questions that you can ask your provider. Here's the other thing to understand. If you are meeting with an OB or possibly even a midwife in an in-hospital setting, perhaps the blood work and testing that they're going to do is going to be a little bit different than if you were meeting with a midwife who is out of hospital or you're meeting with somebody like a functional medicine provider or a holistic nutritionist, somebody who's going to take a deeper dive on the panels rather than just having the blood work done, seeing that all the green check marks say that they're within whatever, and not really looking at the full picture. Now, I will tell you from experience and from my own blood works and things that I have had, this is very much the case. And meeting with somebody who really understands how to do a full panel and read that panel makes a huge difference. I can have a mainstream provider look at a panel, and I can have a holistic provider look at the panel, and they will see very different things. 9 times out of 10, my mainstream providers say, everything looks fine, and that's the thing that you always hear. And it makes you crazy because you're like, no, I'm telling you things are off. And then the other provider is going to be like, The blood work comes back saying that everything looks fine. But here's what I'm noticing. Even though you're within range on this vitamin and this mineral and this nutrient and this hormone, when these are all out of, when you're on the higher level of this or the lower level of this, and these are doing this at this time, this is actually what it means. And then you can kind of start working from there. Now, I'm also going to tell you that when I have somebody read it and they read it fully and they give me feedback and then either supplements or lifestyle changes or whatever that goes along with it, I typically see a change in the better. Whereas another provider might say everything's fine and then they leave me on my merry way. And I'm like, okay, Dr. Google, let's try and figure this out on our own again because something is really off and I can't figure out why. Okay, so some basic blood work that you want to ask for in case they haven't already done this. So you're going to get the basic, right? The very, very basic. But what you're looking for is a comprehensive metabolic panel where you want to do electrolytes. They're going to look at kidney function, and they're also going to look at liver enzymes. Okay. You want to be able to look at all of those things. CBC, which is your complete blood count. And they want to be checking for things like anemia and infection and your overall resilience to things. A thyroid panel, which oftentimes, I don't know why it is such a fight, but with mainstream providers, it tends to be a little bit more of a fight. So just know that you can ask for it anyways, and you would like them to look at it, but they're going to check your thyroid stimulating hormone, your T3 or T4. And then they'll do a urinalysis, right? You want to make sure, okay, does she have a UTI or anything like that? But they also want to check for ketones and hydration. And then you're going to have them check for iron, that's not a word, iron and ferritin. Those two things work together. And vitamin D, which is 9 times out of 10, you're going to be low unless you're already on a supplement or you spend the majority of your day outside in the sun without sunblock. So those are some of the things that you're going to want to have looked at so you get a bigger picture of what's going on. Now let's talk about blood sugar and protein because I feel like this is at least something that is talked about a lot of the time where they say, yeah, your blood sugar, drops after you eat and that's why you need to keep yourself fed at all the times. Or it's why they say have some crackers or something before you get out of bed in the morning and that's supposed to help you feel better. And a lot of times it doesn't. And in some cases, maybe it makes you feel worse. But pregnancy hormones lower the blood sugar overall. And so when blood sugar drops, nausea increases. That's like really common. So signs that this might be happening, it could be like if you are nauseous when you are hungry, if you're feeling shaky or weak, if you're dry heaving or you have bile vomiting, and if you have a temporary relief after eating. So this solution sounds simple, but it's actually really powerful. I am going to tell you, instead of eating those little crackers or some fruit or whatever anybody is trying to tell you to eat to raise your blood sugar, I'm going to tell you to eat every 2 to 3 hours and prioritize your protein. Remember that you're aiming for about 120 grams a day, which means, so if I do 3 meals a day for myself, and I try to hit this as well, I'm usually between 120 to 200 grams of protein a day. I generally, on average, I'm like 120. I do better at about 140 for myself, and I'm a tiny person, but it just depends on your metabolism and a bunch of other stuff. And I'm not pregnant. But for me, it's about we'll say 130 to like 160 is where my body is pretty happy, non-pregnant. And that just looks like I am getting 30 to 40 grams of protein, 3 meals a day, right? If I were to do like a 90 to 120, or I'm getting 50 to 60 grams of protein 3 times a day to hit my other numbers. So that is kind of what it looks like if you were doing a three meal schedule. But when you are pregnant, you want to be doing every 2 to 3 hours. Okay. So if you kind of like eat by the clock and you wake up and you eat at 6 or 7 a.m., then you're going to eat at 9, then you're going to eat at 12, then you're going to eat at 3. And it's about then. You're going to want to listen to your body. You're going to make sure that you're going to hydrate. But those meals should be packed with protein. So if you did, 25 grams of protein in each small meal that you're doing, and you do however many of those a day, we'll say 6 a day, right? You're going to hit 150 grams of protein. And maybe my math is off, but you get what I mean. So you just want to spread that out. And it's really, 25 grams of protein is like nothing. That is like so easy to hit. Now, if you're talking about eggs, it's still like 5 eggs, or maybe 4 grams. Yeah, it's about 6 grams of protein per egg. So you're going to hit 4 and hit 24 grams of protein. And that might not sound appetizing all throughout the day, but the amount of meat that you're going to need for that is going to be a lot smaller. And that's what you want to aim for. Animal protein, meat, fish, eggs, beef, whatever you can do to get that animal protein in and at little bits throughout the day. You can add fats with this as well. So if you want a little bit of cheese, you can use kefir is really, really good. If you're up for raw milk, that can be good. I know that the organic milk and stuff, sure, but because of the way that it's processed, it might be a little bit harder on you. So and it also has lactose. So even the raw milk, even organic milk, whatever kind of like milk you're gonna have, and the cheese, even though that is a source of protein and it is a fat, which is good too, it is high in, or it has lactose, and so it has sugar. And so that'll break down the lactose, break down to sugar, and then you're going to have the blood sugar drop again because it'll spike it up and then it drops it down. The great thing about protein, it takes a second to get the blood sugar up, but it also lets it down really, really loose. So it's going to be better for you overall to be able to like get your blood sugar to where it needs to be, and then it's going to take it down nice and slow. So every 2-3 hours, you're going to do protein. So instead of having those crackers by the bed, which are just going to spike your blood sugar and then quickly make you nauseous because it's going to drop you, and it does nothing for anything else for you. The grains in the morning are not the best thing. I'm going to tell you to aim for that protein. Now, I'm not going to stop talking about this, so just know that protein is going to be like the highest thing on your list. It is so good for everything, and you can add it to your anti-nausea list. All right, let's move on to hydration, because this is one that we might be getting wrong, and it's not even your fault, and it's not on purpose. Now, if you are already feeling nauseous and you're having a hard time getting the water that you need, just general like hydration, then I want you to think of a couple of things that can help. So one of the things that you can do is add lemon to your water. This was a huge one for me. If I couldn't drink regular water, because literally everything, even like the feel of water going down my throat, like everything just makes you feel kind of blah. Adding lemon to your water can be really, really helpful. Same with ice or making sure it's cold. You can use peppermint oil. You can just kind of like smell it and drink the water, smell it, drink the water, right? Because that can kind of help settle that nausea feeling. All of that is really good. The other thing I'm going to tell you to do though is to add some electrolytes. So I use something, I'll put a link for it so you guys can see it. I don't even know the name of the brand, but it's called Relight and it's unflavored. That's the trick though. When you guys are doing the electrolytes, don't do the sugar-free whatever or the flavored whatever and it's flavored with xylitol or stevia or whatever. If it tastes sweet, then your body will produce insulin. So what you need to do is make sure that it is unflavored and unsweetened. Okay, you're not going to do any of the sweet flavored things. That is actually going to make your nausea worse. So trust me on that. Do the unflavored. Now, Relight, it is salt and it's electrolytes. So if you can't stomach that, that's totally fine. You can do like a big glass of it. The more water you mix, the less salty it tastes. It doesn't really bother me that much, but again, I'm not pregnant. So you can add lemon and whatever else you need to that water, and that can be really great for you. But if you're getting the electrolytes in, salt is great too. Salt is like so wonderful for you, and it can actually help with swelling and all kinds of stuff. So if you can get the salt and you can get the electrolytes and you have that water, then great. And I would say start with that in the morning. So whatever protein you need as you're getting out of bed or before you get out of bed, and this is where dads get to help a lot, or maybe you have some beef jerky or whatever that looks like next to your bed. And then you go hit up that nice tall glass of water. Make sure that it has electrolytes in it. It's not just fluid, so it's going to have the sodium and potassium, magnesium, and all of those things, if you are depleted in them, can make your nausea worse. So I think as you start doing some of this stuff, you'll be surprised that you start feeling better, probably rather quickly too, in a couple of days or so. Another thing that you can do is bone broths. Bone broths can be great. And if you can get like a grass-fed, no sugar added, no other additives, just regular bone broth. You can do something like that. You can also make your own. You just crock pot a bunch of bones and water and add salt and some seasonings if you'd like celery and onion and whatever else you want to put in there and sip on that. You can do it warm, you can do it cold, but that can be really soothing for you as well. Coconut water with a pinch of sea salt, that can be great, but again, it can't be sweetened. And then, like I said, those electrolyte drinks, just make sure no artificial dyes, unflavored, and no sweeteners whatsoever. Now, if you're not sure, if you're dehydrated, you haven't been to the doctor, you're just feeling like generally blah, to give you an idea, your urine should be like pale yellow to clear, right? You don't it shouldn't be dark, it shouldn't be stinky, and you want to be drinking at least half of your body weight in ounces of water per day. So if I'm 100 pounds, you want to drink 50 ounces of water. That was just for easy math, but half of your body weight in ounces of water every single day, and you're going to add those electrolytes. If you are working out, walking outside, sweating, then obviously you're going to add a little bit more water, but that urine test is all you need to be able to see if you are dehydrated or not. Now, these next two nutrients that I'm going to talk about have been proven that if you are depleted, can cause nausea. If you get them in check, you can feel better. So B6 and magnesium. And typically the recommended dose of B6, and remember, this is not medical advice. You are going to run all of this information past your provider before you do anything, but you can ask them, how do you feel about me taking B6 at about 25 milligrams 2 to 3 times a day? And they'll probably say, yep, that sounds good. Give it a try. But I don't know what medications you're taking, or if you're already taking a B6 supplement, or if it's in your prenatal or any of that stuff. So this is why you absolutely needed to make sure to run it by your provider. But if you increase your B6 levels, it has been shown to decrease that nausea. Now, along with that is going to be magnesium. And there are a couple different types, but magnesium glycinate is the one that you're going to do for something like this. Again, speak with your provider, but it can be taken orally, and it's one of those calming things, but it helps with a lot of other things as well. And one of them is nausea. And so if you are getting the magnesium that you need, then it can actually help your nausea to decrease. If you're unable to take magnesium orally, you can do Epsom salts baths, because Epsom salt is magnesium. And so if you can't do a bath, the warm water makes you sick, for example, then you can just soak your feet and that can feel really, really good. You can also they have magnesium cream. And so you can rub that on hands, on feet, on legs, on pulse points, wherever you need, so that you're getting the magnesium that you need. So definitely something to look into. There's many options though, especially because pills can also irritate the reflex gland of like, I don't feel so good right now. Brushing your teeth can do it, right? Like everything throws you off. So that's just another way that you don't have to swallow something. Let's talk for a minute about digestion and kind of just sensory input that you might be getting that can, when we adjust it, make you feel a little bit better. So you've probably heard of ginger being a thing that can really relieve nausea, and that's 100% true. However, if you are looking at like ginger candy or ginger chews, that kind of stuff, it's like made with real ginger. Yes, it is. And there's also sugar or corn syrup or whatever else they're going to put in there, or honey even. And that is why if you're using it and you're like, I feel better for a second, or maybe I think I feel better and then I'm not feeling so much better, that might be why. So keep that in mind when you're looking for ginger. The best thing that you can do is fresh ginger, and you can just put a little in your cheek or kind of like chew on it throughout the day. You just get like a piece of ginger from the store. You can just shave a couple pieces off and do that. It is pretty spicy, so keep that in mind. You don't need much. The other thing that you can do is tea. And so again, you just kind of like shred, or what is it? I peel, like use a peeler and just grab off a couple of chunks and then throw it in some hot water and you steep it like a tea. And you can sip on just ginger water, hot ginger water, and that can help too. You can let it cool however you want to do it is totally fine. And actually kind of going into that, the temperature of your foods, the temperature of your room, the temperature of what you're putting into your body can actually have an effect too. So if you try to have warm ginger tea and you're like, that's not going to work, then try it cold. Same with the food that you're eating. If warm foods are not making you feel great, try cold, and vice versa. Typically though, if you're not feeling good, cool air is right. That's what feels good. Cold water is going to feel better. Cooling things, even peppermint has a cooling sensation to it. All of those things are going to help you feel less nauseous. So pay attention to that as well. I think some of those things maybe we don't think about as much, but it's true. Even when you're sleeping at night or during the day and you can make your room a little bit cooler, then yeah, that would be the recommendation. The other thing is to make sure you're getting enough rest. And I know that is easier said than done, especially, for everybody. Like if you're a mom that works, then, and you're like, I am here and I'm getting done what I need to get done. If you're a mom that has a toddler or several little ones at home, you do what you can, but rest when you can, because when we are overtired, whether or not we are pregnant, you can feel nauseous just from being overtired. So remember that your body is growing a baby. Try to give it the time that it needs to rest and use that time to recover and see if that helps you feel a little bit less nauseous. Now, let's say that you go through all of these things. You have the testing done, things are in order or they're not, whatever the case, you cannot, for whatever reason, get it under control and you're becoming more dehydrated and, all the things. Then it is time to meet with a provider, go through all the information. And then if you need to, then you can move on to doing the medication, which I feel like it's kind of the same conversation that we have in birth too, right? It's not about not utilizing the medication, which is available to us and can be wonderful for us, including an epidural or whatever else, right, during labor. It's about having all the information and feeling like we've had control over the situation to the extent that we can in the way that we understand what is happening. We've been a part of the decision-making process and whatever else. And we're choosing, and where maybe we've tried some other things and now we're choosing to move forward with this. As long as that is the situation happening, then you can feel confident that like, yes, this is what needs to happen next. What I don't want you to feel is, oh my gosh, like I never got on top of this, or I wish I would have known this before. And all I did was take the medication and it did or didn't work. And I had this issue with my pregnancy because of it or whatever. And I wish somebody would have told me that there were other options or things that I can look at. So that is why I do these kinds of podcasts for you guys. So before we wrap up here, let's go over a couple of the things that we talked about today, just so that you have them in order before you jump off here. It's important that you get all the information before you make a decision on choosing to do medication or anything a little bit more serious. And that looks like making sure that you have correct blood panels, read by the correct providers, and given good information so that you can make decisions moving forward. Remember that blood sugar is a huge part of this. You are more sensitive to insulin during pregnancy. And so making sure that you have high protein meals and snacks throughout your day, every 2 to 3 meals, can be super helpful. The next thing is going to be making sure that you are hydrated, and that includes proper salt intake and proper electrolytes. So magnesium, potassium, sodium, all of those things go together to help you form that really good hydration. And the way that you can check if you are hydrated or not is by your urine output, how much you are urinating, and the color and the look of it. The next thing is that B6 and magnesium. Those are things that you can try, whether it's a cream pill or otherwise. And then make sure that you are getting that gentle digestion in the way of helping with the ginger or making sure that meals are hot or cold or whatever you need. And same with the air and all of that. And then if you need to, then we move on to the medication. Now, remember that you are growing a baby and it is hard work. You are doing the hard work every single day, and your body is trying to adapt to something extraordinary. Now, the good news is that when that placenta really is on the grow and things kick in and hormones normalize and all that stuff that happens during that first trimester, the majority of the time you should find some relief around that second trimester time, 12 to 14 to 16 weeks. And if you're past that and you're still feeling nauseous, or you end up going there and you're still feeling nauseous, I really, really encourage you to do some of the things that you heard here today. And if you know a mom that is struggling with this, I want to encourage you to pass this episode along as well. And lastly, if you have not yet, please take a few moments and leave a review for the Pregnancy and Birth Made Easy podcast. It allows me to keep doing this week by week, because as that podcast goes up and it's shown to more moms, then we get to spread the word a little bit more. And I can sit here with you guys every week and teach you a little bit more about pregnancy and birth. And I will see you next week for another episode. If you loved what you heard today, the very best way to support this podcast and help other moms to find it is to leave a quick review. I read one at the beginning of the episodes, and I would love for yours to be next. And if you're ready for even more pregnancy, birth, and postpartum goodness, come join me in the My Essential Birth course at myessentialbirth.com, where I will hold your hand and walk you through pregnancy and birth step by step so you're totally prepared for a birth you'll love. See you next week.